Among Fort Healthcare's unique abilities, and what makes it a leader among rural hospitals in Wisconsin, is their simulation laboratory.
The Fort Healthcare Simulation Laboratory is an environment where staff can practice their skills and their techniques before they actually get into the patient arena. A lot of places are able to rent the mannequins. We actually have been very fortunate to have our own mannequins here.
Having the mannequins out at any time allows staff to come down whenever they need to, feel like they need to improve on anything, and we're able to help them out right then and there.
Using high-tech mannequins, care providers are able to fine-tune clinical decision-making and patient care skills that are important to achieving excellent health outcomes.
Here in the simulation lab we have several sessions, about 30 a month, and we involve nursing staff, the cleaning staff, the cooking staff, any staff that might have any contact with any patients get to come through the simulation lab.
We can also walk through various disease process and what those look like to try to encourage good critical thinking skills. There is a direct correlation between simulation and good patient outcomes. We are able to have staff practice and hone their skills before they go onto the floor, before they start having to practice on actual loved ones.
All right, so we're going to assess her. And we have bleeding. Oh boy. All right, Matilda, are you okay?
The key to providing exceptional care is the quality and skills of people and teams who serve Fort Healthcare's patients.
I work in the operating room as a circulating nurse, and a circulating nurse is responsible for many different things as far as pre-op, getting patients ready to go, making sure they have labs and H&Ps, and then I'm also the nurse that's in the operating room with the surgeon. Some of the simulations that I do here are advanced cardio life support. We also take care of learning how to do IV starts. We learn how to do arterial lines. It helps us because when we work in the OR, when things occur, they happen very, very fast. And so we need to know and keep our skills very sharp. By using our sim lab, I feel we have better outpatient outcomes because we are prepared, we are educated, we are knowledgeable, and we've practiced.
I'm a registered nurse on the medical surgical floor. I care for patients post-op. The sim lab has helped me with caring for my patient, teaching my patient correctly what's going to happen to them and how to effectively care for themselves when they go home so they don't come back to me. I love my patients, but I would like them to be healthy, and I want to teach them along the way to stay healthy.
So, how do you think it went today?
I thought it was wonderful.
Best thing you've ever done?
Yeah, I learned a lot today. I was surprised.
The Fort Memorial Hospital Foundation made it possible to establish the Sim Lab and expand its offerings.
The foundation's support for the simulation lab was the opportunity to create something unique in rural health care in Wisconsin. The things that our nurses and caregivers learn in simulation improve the care that's received by every person in the community who relies on Fort Healthcare. In addition to funding from the Kachel Foundation and the Arthur and Nancy Nesbit Charitable Trust that provided seed funding for the program, NASCO has been one of our primary partners in the program.
Not only is this program beneficial to train us in this hospital, it's open to businesses, schools. They can train their employees with CPR, wound care, a variety of things that'll benefit everyone in Fort Atkinson and the area communities.
As technology grows and challenges increase, your help is needed in order to build on Fort Healthcare's focus of improving the health and well-being of our community.
We're very fortunate to have the simulation lab that we do, but we're always looking for ways to improve and ways to incorporate new product into our teaching.
I love being part of this program because we do really make a difference in patients. My family comes to this hospital, and I feel very confident that we can take very good care of people here.